In progress.
I'm sorry for the delay. I actually had a puncture that totally disoriented me. But that's fine. At least I'm now presenting. Just confirming this is the 4th year class.
Yes, Dr. Wangai.
All right. Okay. So we'll have a short lecture. It's not very complex. I'll try and make it a bit interactive. My name is Dr. Wangai. I'm one of the lecturers here in the Department of Medicine. Just to get a little bit of a background, what have you guys done so far in the infectious disease series?
Assessment of a patient with fever with Dr. Rice.
Okay.
That's it.
That's it?
Yes, this is the second class.
Oh, wow. Okay. What did you learn yesterday? Or assessment of fever?
Just learned how to what to look out for in a patient with fever and what to expect, what questions to ask. Yeah.
Okay. All right. Fine. So when you think about infectious diseases, and I think for those of you who have rotated through my ward, infectious disease, we always say that internal medicine, you need to be able to classify things. So try and organize your knowledge. Once you organize your knowledge in your head, then that's how you actually get your marks and you become a good doctor. So if you think about the infectious diseases, you have bacterial diseases, you have viral diseases, you have fungal diseases, you have parasitic diseases, you have microbacterial diseases. So what we will undertake today is one of the parasitic diseases. I'm sure we all did this in second year microbiology, schistosomiasis. This is just a brief outline of what we will go through today. And by the way, this is a very good outline that you should use even for any other topic in IMED when you're trying to think about how to revise for your exams, even when you're thinking about how to write your essays. Always have your definition, think about epidemiology, etiology, pathophysiology, clinical presentation, history, that's under clinical, and investigation, then have an overview of your management. So try and organize your knowledge with your short notes, your revision when you're studying. Try and use this kind of format because this is what you need. Someone is asking, can you please increase the volume? Can you hear me? Hello?
We can hear you well, Doc.
Okay, all right. Fine, that's good. All right, so I decided to try and make this a bit interesting for you guys, and I would like to see someone who is brave enough to answer this question, or part one of this question. So a 43-year-old rice farmer from where presents to your facility. Now you're in your ward 8D, 8B, and this patient presents to you and you're the one who's clerking them to present them to a lecturer for your ward round. And this rice farmer presents the 2-month history of generalized abdominal swelling and yellowness of the eyes. So, part one, what further history would you like to elicit from this patient for 5 marks? Now, this is the format that we actually use for your exams. So I thought I would give you a sample question to help you see what we expect from you. To this part one, what further history would you like to elicit from this patient? Please don't make me pick. Anyone here?
Hello.
Yes.
This patient has jaundice, and most probably you'd like to ask him if he wears gumboots when he goes to the rice farm, and on physical findings like his liver might be enlarged and things like that.
Okay. Good. Anyone else?
Well, Dr. Wangai, there are also some students interacting in the chat box.
Okay. Chat box. So someone says stool color, history of pain and bleeding in the stool, history of hematemesis. All right. Okay. Okay, let me ask the guys who are in the gastro ward. Someone from 8D. I know you guys, so don't make me pick on you. You'd rather volunteer. Okay, is Kasim here?
Hello, yes.
Yep, go on ahead.
Okay, so as he has yellowness of the eyes, you'd also like to ask of dark urine, pale stools, so as you can get the full picture of obstructive jaundice. Also, you need to ask about itching, because it also presents with the pruritus. So, and if there is, has he had any of these symptoms before, as he's like a rice farmer? If he wears any protective, how do I say it, like gumboots, gloves, and all that when he's farming? Yeah, that's for part one, the further history. And then if there's also any blood in stool, the hematemesis.
Okay, good.
Oh, and he
so
has any medications, and since we are on the liver, if you can also rule out hepatitis, like by asking questions about if he has had any tattoos, and his sexual history, if he's had many sexual partners, and fevers.
Very good. Very good. Now, remember, guys, when you see a patient and you are trying to take a history, you need to quickly in your mind within a couple of minutes which system is involved. Now, for this gentleman, someone who has abdominal swelling, yellowness of eyes, what is your first thought in terms of which system or which organ could be involved?
The liver.
Yes, your liver. So you need to ask questions around the liver. So liver symptoms that the patient would present with, like physical exam findings that the patient would present with in a liver disease, and then also risk factors, associated factors, and etiological factors. Now, that is where your marks will come from when you are presenting your history. So we rate you tell us about the patient did not have this, the patient had this, the patient did not have history of herbal medications, the patient, as Kasim said, sexual, because you're thinking of maybe hepatitis. You'd want to know more about the symptoms. Do they have obstructive jaundice, such as, having pale stools, having pruritus, dark urine? That would be a more obstructive jaundice picture. Does this patient have a liver malignancy? So you'd want to ask about things to do with constitutional symptoms. So you need to think broadly when you're taking your history and try and explore multiple causes of whatever you're seeing. Do not focus on one particular aspect. Does that make sense? So your paragraph for your HPI needs to follow that kind of an order. So start with your symptoms. So your symptoms are abdominal swelling, and for that first paragraph of your HPI, abdominal swelling, explore it in totality. What kind of things would cause abdominal swelling? Talk about the progression, and then associated factors. And then yellow nasopharyngitis would be your second paragraph. Talk about jaundice. What kind of things cause jaundice? Malaria can cause jaundice, for example. So you need to explore that second paragraph. Then the third paragraph of your HPI, now start looking at various risk factors and associated factors. No one mentioned alcohol. Alcohol is an important thing that you need to have in your HPI. Are we together until there? Any questions before we move on? Because this is actually an important part of the lecture.
No, we're together. We're together.
Okay. If you have questions, you can feel free any part of the lecture to post them in the chat box. Now, number two, what would you be likely to find on physical examination? Okay, who would like to take a shot before I pick on someone?
Can you say hepatomegaly?
So, take us step by step. So on physical examination of this patient's abdomen, on inspection, I'll find 1, 2, 3. On palpation, I would find 1, 2, 3. On auscultation, 1, 2, 3. I'm trying to train you guys to know how to answer questions so that when you're asked in the ward or in exams, that's what we expect. Just be organized. So try again.
On inspection, you may see generalized abdominal swelling with flank fullness. You may see distended veins.
Okay, describe the patient that you see. So on inspection, I see, or yeah, continue.
Oh, yeah. That's of the abdomen, of the palms, jaundice, pulmonary edema, pallor. Yeah, as you go up to the face, you'll see scleral jaundice, you may see conjunctival pallor. In the mouth, or around the eyes, let's see. Yeah, okay. So as you go down the mouth, you'll see pallor on the tongue. Underneath the tongue, you'll see jaundice on the frenulum. If there's malignancy, you may find vitreous nodes. Yeah. Then I'd started with the abdomen.
Okay, good, very good. So abdomen, what do you see in this picture?
Generalized abdominal distension with flank fullness. You may the veins are visible. There's wasting. Okay, I'm done.
Okay, anyone else would like to help her? Lynette and Jerry.
Okay, for general exam, I think she's covered it. You would find a wasted patient who has jaundice, pallor, maybe edema even in the lower limbs. And on examination of the abdomen, on inspection, you'd see generalized abdominal distension with distended veins on the abdomen. And then on palpation, you may feel a hepatomegaly, maybe a tender hepatomegaly and splenomegaly as well. I don't think you'd find any other masses. And on auscultation, I'm not sure if you would hear bowel sounds. Maybe you'd hear bruit over the liver, maybe a venous hum. Yeah.
Okay, how would you confirm for the presence of ascites in this patient?
You'd percuss. So you'd start maybe from the xiphisternum, and then you move downwards until the point of maximal resonance. And then from that point, you would percuss towards yourself until you hear dullness. And then you would ask the patient to turn over, and then you would percuss upwards, and it would probably sound resonant, and then you percuss going downwards, and it will become dull, which would prove shifting dullness. And you can also do a fluid thrill.
Mm-hmm.
Yeah.
So there are three signs of ascites. You mentioned shifting dullness. You mentioned fluid thrill. What is the third sign?
Generalized abdominal distension with flank fullness.
Yes, fantastic. So some of the things that I needed you to have noticed here is, yes, you have uniform distension and it's not one-sided, all right? So this is something that's affecting the whole abdomen. Number two, the umbilicus right here. You can see my pointer.
Yes.
And
Yes.
the umbilicus here is everted. I forgot to mention that. Number three, you guys actually didn't mention the hair distribution. Really, really important. So when you have sparse hair distribution, like this gentleman, you can see the hair is thin. It is basically sparse. It's not covering the whole chest. Okay. In a patient with abdominal swelling, these are some of the signs of chronic liver disease. The patient is also visibly wasted, implying a chronic disease. Something you need to check out is stigmata of chronic liver disease. I think they're like 10 or 12 different things: pulmonary edema, dupuytren's contracture, such things, you know, and then go and actively look at, because these are some of the things that we like to ask in OSCEs, especially. Fantastic. Number three, what kind of investigations would you like to do in this patient and why? Would like to have. Okay, fine. Then I'll ask Caleb Mukiti. Caleb. So TED, Osorosis, LFTs, abdomen, flank fullness. Oh, sorry. FBC, that's MISPA. to check for anemia, urobilinogen in urine. Complete blood count, stool test, stool, ovarian cyst, analysis of the ascites fluid. Okay. Number 4, what are the likely prevention and control measures you would like to undertake in ask who should we ask? Let's ask Uba. Is Uba here? Okay, she's not here. Tea Nyamisa.
Wearing protective gear like boots and gloves. Yeah, education on infectious diseases and their prevention.
Very good. Very good.
I can't think of any other.
Someone says proper sewage disposal, praziquantel, so praziquantel mass, praziquantel use, molluscides. Prevention. Yes, by the way, whenever you're asked what are some of the prevention measures or control measures, something that you can always say education. Education is always one of the things that will always give you a free mark. All right. So that's how your exam will be formatted. Is that, I hope it's not right? Okay, good. So basically, when you talk about bilharzia or schistosomiasis, named after a guy called Bilharz, who was a German pathologist and basically was working on autopsies and discovered, actually, patients with hematuria, one of the things that could cause them is worms. So when you look at the soma, worm is just a picture of one. They are what we call flukes or trematodes. So there are other trematodes that you also need to know of medical importance. Today we'll not talk about them. I'll just show you this small video to wake those of you up who are sleeping right now.
Schistosomiasis is a tropical disease caused by a group of parasitic worms called schistosomes. These worms are also called blood flukes. The disease has affected people for thousands of years, and evidence of the disease has even been found in Egyptian mummies. Schistosomiasis is also known as bilharzia, named after Theodore Bilharz, who first described the parasite in humans. It's estimated that over 200 million people around the world are infected with these parasites. In sub-Saharan Africa alone, it causes over 200,000 deaths each year. Schistosomes have a very complex and interesting life cycle involving humans, snails, and fresh water, such as lakes, ponds, and reservoirs. 5 main types of schistosomes are responsible for most human disease. They differ in their distribution, the kind of disease they cause, and the type of snail. Hematobium is mostly found in parts of Africa and the Middle East and causes disease in the urinary and genital areas. Mansoni are mostly found in Africa, South America, and the Caribbean. Japonicum in parts of China and Southeast Asia, Cambodia and Laos, and Mensis in Central Africa. These affect mainly the bowel and liver. Let's have a look at their life. Infected humans pass schistosome eggs through their feces or urine into fresh water. These eggs then hatch into larvae and infect certain species of snails. After a period of development in the snail, they're released back into the water in a form called secari. The Secari swim and penetrate the skin of a human and can enter the body of someone using the water. Once in the body, they find their way through the lungs and into the liver, where they grow into adult worms. They then migrate into blood vessels surrounding specific organs, where they can live for many years. Some species of Schistosoma like to live around the bowel, whereas other species prefer living around the bladder. These adults can lay thousands of eggs a day. Some of the eggs find their way back into the water through urine or feces and start the life cycle again. But some eggs get trapped in the organs. Schistosomiasis can cause both short-term and long-term disease. When the Secari penetrate the skin, some people develop an itchy rash called swimmer's itch or fisherman's itch. Some people can develop a syndrome called acute schistosomiasis, also called Katayama fever. This occurs about 4 weeks after being exposed to the parasites for the first time. It usually presents with a fever and a range of other symptoms, such as diarrhea, rash, and respiratory symptoms. This is usually self-limiting. The long-term effects of schistosomiasis are more serious and occur as a result of the eggs that are trapped in various organs. The trapped eggs can lead to changes in tissues characterized by the formation of granulomas with a lot of inflammation around them. In the bladder, this can lead to hardening of the bladder wall, obstruction, and can even result in a type of bladder cancer. This can present with symptoms such as blood in the urine. Intestinal schistosomiasis can lead to symptoms such as abdominal pain, diarrhea, and blood in the stool. In the liver, the eggs can cause scarring of the tissues around the vessels of the liver, obstructing them, and can cause enlargements of the liver and spleen. Other organs that can be affected include the genital system, lungs, and sometimes even the brain. Chronic infection, especially in children, can lead to anemia. How is the disease diagnosed? Well, the disease can be diagnosed from the urine and stool using special techniques, or by biopsy of tissues and examining it under the microscope. There are blood tests that can look for antibodies against the parasite. There is no vaccine against schistosomiasis yet, but there is effective medication to treat the disease. They usually work by killing the adult worms, which means that the eggs are no longer produced. Recovery of the affected organs depends on the type and extent of the damage that has already taken place. So how do we prevent the disease? Preventing the disease can occur at various points in the worm's life cycle. Remember the life cycle? The spread of schistosomiasis needs an infected human who contaminates the water, a snail, and subsequent contact with another human who uses the contaminated water. The disease can be eliminated in humans using medication. In areas that have a lot of disease, entire communities or targeted at-risk groups can be treated with medication to reduce the incidence of disease. Large-scale drug treatment has been an effective way to control schistosomiasis. Another approach is to reduce the contamination of water. This involves activities such as educating people on proper sanitation and providing necessary facilities such as toilets. Some countries have tried to eliminate snails by using chemicals or biological control methods. Their effectiveness has been variable. The other way to prevent the transmission of disease is through reducing contact with contaminated water. Tourists can be advised not to swim or wade in areas that are known to have schistosomiasis. However, avoiding water can be hard to do for people who live near water and depend on it for their livelihood or for basic functions. Providing clean water sources for drinking, cooking, or washing clothes can reduce contact with contaminated water. So that's an overview of schistosomiasis. For more information, have a look at the websites below.
Okay, I think actually the lecture is done. The video has explained everything I wanted to go through today. But just as a reminder, remember there are different types of schistosoma. There is intestinal schistosomiasis, then there's urogenital schistosomiasis. So we mostly see a lot of hematobium in our setting and Mansonia, but you need to know the rest, especially for your MCQs. This is something that you are all familiar with, especially since you've done microbiology before, so I'll not go into this in detail, but basically remember the life cycle: egg, water, snail, Secari, penetrate the skin, then we go into the circulation, and based on which species either they reside in the liver or in the intestines or also in the bladder. And then this cycle continues. Also need to remember your hosts and your reservoirs. So for Japonicum, cattle, dogs, cats, rodents, blah, blah, blah. Mansoni as well. Also remember the snails. The snails are very, very important to remember. So Biomphalaria for Mansoni, Oncolmelania for Japonicum, Bulinus for your hematobium. This is really important also for sports because we like to give snails and pictures of eggs for your sport exams, which you will have. Now, just as the video said, when you're thinking about clinical syndromes for schistosomiasis, there's a swimmer's itch, there's the acute schistosomiasis, what we call katayama, and then there's the chronic schistosomiasis, as we've already explained. This is just a photograph of what we call the swimmer's itch, as you can see on that. Remember your pathology. The pathology of schistosomiasis is basically that of chronic inflammation with granulomas. And anyone know any other disease that causes granulomas?
TB.
TB, yes, very, very good. And so this chronic inflammation is the one that causes your symptoms, your reaction to the eggs of the schistosoma is what now causes your inflammation, rather is what causes your disease. So it's not the worm itself, or it's not the egg itself, but it's the body's reaction to it. Just like, for example, in COVID. So in COVID, your inflammation or your response to the virus is what causes your disease. And so some of the things that you can see in this patient, for example, who has portal hypertension, basically the liver is fibrosed, part of chronic inflammation as a result of, or as a response to the eggs in the liver. And so that blocks the portal circulation with a resultant overflow into the spleen. So you get a splenomegaly, you get an ascites, you can get esophageal varices, also get hemorrhoids as well as part of portal hypertension. So those are some of the things that you'd want to look for in your physical exam, and also when you're investigating such a patient. Just reminding you of the acute syndrome or the Katayama syndrome. Basically, within 2 weeks, that's when you'd want to start seeing these symptoms such as fever, cough, abdominal pain, diarrhea, eosinophilia. Now, depending on how good your immunity is, you could either clear this, or if your immunity is not as good, it would proceed now to chronic schistosomiasis. Now, the main areas where chronic schistosomiasis is involved is in the CNS, also in the gastrointestinal system, and in the genitourinary system. So if the eggs, for example, lodge in the brain and the spinal cord, then now you'd have things like seizures or convulsions, for example. You'd have the features of a space-occupying lesions. You could have a hemiparesis or paraparesis, for example. If the eggs lodge, in the hepatic system, as I already mentioned, you'd now get features now of chronic liver disease. Very important is that hematobium, apart from causing hematuria because it lodges in the urinary system, in the long term causes squamous cell carcinoma of the bladder. So that's a very, very important thing to remember. Okay, I think also here genitourinary, especially for the females in this class, is a very important cause of infertility, for example, because that inflammation just destroys your whole female reproductive system. So when you're taking a history, it's really important to have your geography in mind and your epidemiology in mind. So what does this patient do? For example, the case I gave you was a rice farmer, meaning they probably wade through the pools of water in rice farming. Very important also to know their residence history. Where do they come from? Very important, because you know that schistosoma is geographic in nature. We mentioned already that you can look for your eggs. Now, depending on which schistosoma you have, don't only look for stool, ask also for a urine sample so that you can do your microscopy of your urine sample. It's really important to know when or what time to take your urine specimen, such as for hematobium, it's best to do 12 to 2 p.m. When you're now taking a stool specimen, the stool specimen will be subjected to a cattle fixed smear procedure, and that's how you'd be able to identify your eggs. Also remember, you can do a tissue biopsy, for example, if someone with CNS manifestations or someone who may have, for example, intestinal manifestations, and you're able to see mass there, take a biopsy and you'll be able to demonstrate your eggs. Now, this is an example of what we call a spot exam. I think you do it in 6th year, not in 4th year, but I just thought who can identify the eggs as in A, B, and C?
Hello.
Yes, hey.
I think A is Monsoni. B is hematobium, and the last one is japonicum.
Okay. Good, very good. So A, yes, is Manzoni, and you're looking at the spine right here. So the spine is a lateral spine, whereas hematobium has a terminal spine, and japonicum does not have one. So very good. Then the snail in the diagram. So what snail is this? Would like to hazard a guess? You guys did microbiology just the other day compared to me, so you should know this.
Bolin snail.
Yes, so this is Bullina snail. So Bullina snail looks like a, what does it look like? An ice cream cone. Yeah. Whereas this, on the other hand, is what's Valerie Wambani.
Biompilaria.
Yes, this is Biompilaria. So it's important to know. So important to know which snail hosts which organism. Okay, very good. Biompilaria. So there is a role for blood testing. So you have schistosomal antibody tests against the worm itself. Would like to do this especially for travelers who have come from an endemic area. Now remember, antibodies are not specific for when the infection happened. So it will not tell you whether the infection happened recently or it's a current infection, because antibodies really are a response to an infection that could have happened, 3, 4, 5 years ago. So they're not specific. Okay. They're also working on an antigen test that will now be more specific for current infection. It's important that when you're looking for your antibodies, you need to collect at least 6 to 8 weeks after a likely infection. If you collect it earlier, you're unlikely to get an antibody positive test. Remember, treatment is only the main drug that we use is praziquantel. However, we can also use things like oxamniquine and also antimalarials. Some antimalarials that have effect against the schistosoma Mansonae and hematobium. Very important to know that you may also use steroids if you have very aggressive Katayama fever, and also in CNS disease where you have a space occupying lesion in the brain. Steroids also help to reduce your syndromes. Really important to remember prevention measures, as was mentioned in the video. I will not repeat them, but remember, even for other diseases, think about the life cycle. You can always do a prevention step or a control step in every stage of the life cycle. So be it, for example, making sure there are toilets so that you don't have or proper sewage disposal, as someone mentioned. Then think about the stages in the water. What can you do in the stages in the water? What can you do in the stages for contact, for example? So that's a nice organized way for you to try and answer such questions if you're asked. Then there's also control on the other side, which we've already mentioned again. So you can either eliminate the host or the reservoir. You can talk about also things to do with the person who's infected as well. You also talk about prophylaxis, so mass drug treatment of communities that are in an endemic zone. Yeah. So another question: which of the following is a common manifestation of renal disease in this condition? So sometimes we ask questions that are not direct, so they require you to work on your level 2 and level 3 knowledge. So meaning that you're supposed to know what you or identify, you're supposed to identify what you are looking at and work 2 or 3 steps ahead. So for example, for this question, who would like to answer this? Okay, so I see Sarah and Sigila have said C. I see someone has said glomerulonephritis. Felicitas, glomerulonephritis. Mangeshi C, Felix A. So remember, this is what species?
Schistosoma mansoni.
Hematobium.
Hematobium.
Yeah, this is hematobium. So remember, you have your terminal spine. So hematobium, you would think, would reside in your urinary or genitourinary system. And remember, I mentioned to you that in these kind of cases, you would get a chronic inflammation. So it's a chronic disease, not the acute. And the chronic inflammation is what causes your symptoms. So one of the hallmarks of chronic inflammation would be a granuloma. Good. Next, which specimen, oh, this is an easy one. Which specimen is this organism usually isolated from? So always be careful about the answer A in exams, really, in general. You have to have a really strong reason for you to choose an A, because most of the time we put the false answer in A. So yes, the answer is urine. So in summary, what I needed you to remember is schistosomiasis is prevalent in our setup. It has 3 main forms. There's an acute form, there's a chronic form, and there's the swimmers itch. Each of them have different manifestations that you need to know about because of your history, your physical exam, and also your investigations that you're going to take. Another thing you need to remember is your prevention and control, because one, you need to help your communities, you need to help your patient, but also we love to ask questions to do with community health and prevention and control in exams. So that's another good motivation for you to remember that. Good. And I am done. It's exactly 40 minutes since I began. I hope you learned something. I hope you enjoyed the lecture. Are there any questions that anyone would like to ask?
Recording stopped.
Thank you, Dr. Wangai, for the amazing lecture. I don't think there are any questions. Kindly request if we can move to our next class.
Okay.
Thank you. Have a good day, Doc.
Good day. So next week we're going to tackle leishmaniasis. So try and read up on it before the lecture so that we can make it more interactive.
Yes, we will.
Okay.
Okay.